okay? So I'm gonna do some hands-on testing. There's a test called Clark's test, okay? And it'll show you, don't disregard the camera, it'll show you, you're gonna feel different things in the knees. It may kind of mimic some things that you feel when you're just doing your daily activity or when your knees are sore. Okay, so you'll see what I'm talking about. We're talking about pain from the neck, upper back, all the way down the low back, down your arms, right? Mm-hmm. Okay, you're gonna make me laugh this whole video, man. So in the neck, are you dealing with sharp shooting pain down the arms, or is it like numbness and tingling?
It's like aching.
Like aching?
Mm-hmm.
Okay. You said you have like bilateral shoulder pain as well?
Mm-hmm.
Okay. Knee pain, shoulder pain. What about ankles? No. Okay. And then in your back, do you feel more like muscle fatigue, or do you feel more like pain that radiates down your legs or up your back, so on and so forth?
It's more like someone is just like, they have their fist pressed up against my back really hard.
So some tension in the back. Okay. All right. Well, I'm going to do some exam, right? Some of this exam is going to be, I have to palpate and ask you questions, okay? Because what I'm trying to do is I'm trying to paint a picture, right?
Yeah.
Is it leaning more this way, or is it leaning more this way, right? When we're talking this way, we're talking like, are we leaning more like disc herniation, pressing, impingement of nerves, or are we dealing with like muscular issues, tightness, so on and so forth? Commonly, in somebody your age, a little bit younger, we're dealing more over here, unless it was like traumatic, like I fell down and now my pain is radiating down my leg. That would be a trauma, right? You haven't really reported a trauma. You're just saying these things are bothering me. The knee issue, we're going to address that as well, because that may be as simple as trying to instill supplementation to try to help with that knee pain. Okay, so we're going to get started here. So the first thing I want you to do, I want you to stand up right here, facing the mirror. Put both hands, yeah, you can put them down. Put both hands on your hips right here. Find your pelvic bone and just look straight at the mirror. Try to square up straight with the mirror, okay? So you're looking forward. Let's have your try to put your feet where they're right at the same level, right? And look forward, okay? Now you're gonna basically look forward towards the mirror, and I want you to tell me if you find any differences in the hand placement, any height differences.
All right, what feels higher?
Feels higher, right? Looks higher, right? I do that so as you're standing, you're like, oh, should my pelvis be one side higher than the other? That's not, it should be pretty level, right? Mm-hmm. So we're seeing them high on one side versus the other. How do you sell coffee? You're laughing all day long.
I don't know.
So here, touch both feet for me.
I have to touch both feet?
If you can. Just checking your flexibility. All right, good. Come back up. Any pain with that? No? All right, cool. We'll continue. You can come right over here. Let's have you sit right here. Facing this way is fine. So have a seat right at the table facing that way. Let's have both arms out to the side for me. All right, relax right here. Don't let me push down. Any pain with that at all?
No.
It seems a little ticklish? No, kidding. Relax right here for me. You can relax your arms. Now, when I'm pressing here, what do you feel?
That kind of hurts.
Kind of hurts, right? Right in here? Nope. Right here kind of hurts. Okay. How about in here? Kind of hurts? Yes.
That one hurts.
Okay. All right. Relax right here for me. Okay. Bring your shoulders back. Try to sit up straight. Sound like a parent, right? Sit up straight. Any pain with that right there?
No, it just feels weird.
Feels like tight?
Yeah.
Okay. Any pain with there?
Mm-mm.
Nope. Okay. Relax here. Any pain right in here? No, okay. So here's what I was checking. I have you put your arms up, right? If we were dealing with some sort of nerve impingement in the neck, herniated disc, what do you think might happen?
It hurt.
Well, not only would it hurt, but the nerves come out of the neck, come to here, so you might have like one arm that's weaker than the other. That would mean that would point to me that maybe there's something on a nerve or a central nervous system that's not functioning right. You got good strength. The neck's there's some stretching when we're palpating. It's like tender when I'm palpating different things. So I'm leaning more towards muscular versus something central. Okay, that's kind of what I'm already analyzing. I want to walk you through the diagnosis. Since you're kind of new to this, I want to walk you through my frame of thinking. Okay, so if you want to put your phone right over here for me, okay, and then let me have you lay face up right there for me. So lay your head right in that headrest and lay face up. So, would you rather go by Tony or by?
Sure.
What do you go by? Tony. All right.
Yeah.
All right. All right. Without bending your knees here, I want you to lift both legs for me.
To lift both legs?
About 45-degree angle.
That's a lot.
How about just like few inches? All right, cool. That's like a 90 degree angle. Come back down.
Wait, 40.
Right there. There you go. Good.
I forgot my math.
Almost did 180. All right, don't let me push down here.
Wait. Oh.
Don't let me push down.
I was like, why are my legs going down?
Is that tender at all?
No.
Hold it up a little higher. Hold it right here. Don't let me push down. Any pain with that?
Yeah, I'm good.
That's good. All right, you can relax there.
I just need to work out.
So you're feeling like you're just struggling to hold them up, but no pain, like nothing in your low back when we were doing that, right?
Mm-hmm.
All right, I'm going to help you up here. Any pain or tenderness when you get up like that?
Just stiffness.
Just stiffness?
Mm-hmm.
Where's the stiffness that you're feeling when you're moving like that?
My entire body.
Entire body feels stiff,
Yeah.
okay? We're going to check the knees now, okay? So I want you to try, can you stand up and do like a squat for me? Or even a half squat?
This is going to be I was cleaning my car and I was having issues.
Come back up. Okay, you hear that? And that hurts, right?
Yeah.
Okay, that's what I'm looking for actually. Lay face up there for me. The description of what you got going on is as you put pressure against the knee and the kneecap, the back of the kneecaps rubs against the front of the cartilage that's supposed to be in front of the bones of the knee, it's like scraping, okay?
Yeah.
This is called chondromalacia patella. Now I'm going to do what's called Clark's test, and you're going to see what I'm talking about here, okay? So I'm going to get in here, we check, feel that scraping? And it's tender, right?
No, I just felt it pop.
Did you feel? No, that's scraping. That's not like a pop that you see. Now I want you to contract this muscle here. So contract your quad.
That hurts.
Hurts? Okay. Relax this side here.
Oh, I'm scared.
Can you straighten your knee out? There you go. Contract that knee. Pain with that? Yeah. Was it when you stood up and you heard that scraping, that popping? Was it painful?
It was uncomfortable. It wasn't really painful. Sometimes it is painful.
Okay.
But if I'm down there for a while and then I get up,
right,
it's really painful.
So remember when we're reporting a possible history of some arthritic changes, okay? That's chondromalacia patella, right? That's going to be the where the cartilage is supposed to be. It's kind of worn down, and there's some inflammation behind the cartilage. We know because when we press and you do the contraction, it shouldn't be painful, okay? But it is in your situation when it's positive. We have chondromalacia patella. What are we going to recommend? I'm going to help you out so we can chat a little bit, okay? So with something like that, we recommend if think about it, the joint is distorted, a little dry, okay? We want to recommend something that's going to hydrate the joint. So the things that are going to be more beneficial for hydrating the joints: glucosamine chondroitin, fish oil, and vitamin D3. Most people take just like glucosamine chondroitin. Okay, that's what most people are going to take. D3, you can get it from the sun. Fish oil, you just kind of eat better omega-3 foods, and you might be able to get some of that through that. Okay.
Wait, so like, go outside and like tan?
Yeah.
Mine's built in.
Well, I know that, but we're not tanning your skin. We're just promoting increased vitamin D3.
Okay.
Right, and the sun does that. Mine's a little built in too. And that's why a lot of times, like nowadays, we have inside jobs, right? So we're inside. Like here today. Yeah. I got here at 9. The sun was out a little bit, but I'm gonna get out of here. It's gonna be dark outside. Yeah. So a vitamin D3 supplement might be very good for me. Vitamin D3 is important. It's the biggest vitamin in your body. Okay. Vitamin D3 acts like a car, so it's the biggest vitamin. You taken any class, or you've taken classes before where you remember chemistry at all? Not really? Yeah-ish. Yeah. So we're going to give you some chemistry lessons. So let's pretend my hand is vitamin D3. All these little fingers here are receptors, okay? So receptors are going to bind other vitamins, other vitamins. Now your cells are made of a phospholipid bilayer. So the outside layer of your cell, this kind of familiar, is made of a fat layer, okay? Vitamin D3 is fat soluble. So when vitamin D3 enters your cell, because it's soluble, it takes all the other vitamins with it. So now your cells are receiving the nutrients they're supposed to. That's why D3 is important, okay? And so D3 is important. If you're in an inside job, you might want to take a D3 supplementation. And D3 is known to help with joint pain, along with glucosamine chondroitin. Fish oil kind of helps lubricate the joints. So in general, as a patient, I would recommend a glucosamine chondroitin. We have a product here that we recommend for patients. I'll have patients that will come in with knee pain. They'll take a bottle and try 1 pill a day. Mind you, the bottle says drink 2 pills a day up to 3 times a day. That's a lot of glucosamine chondroitin. You may end up disposing of some of the stuff you don't use. So my method is like try 1 pill a day, see what that does. If you're like, it's a noted improvement, not too much, go to 2. And then some patients report, wow, I'm taking 2 pills a day. I feel amazing. My joints aren't hurting. That's what you needed. That's what you're absorbing at that point, okay? So that's how we recommend to try to attack and try to handle the joint issues that you've been dealing with. Okay. Overall, that's what we're discussing with joints. Usually, it's going to be most commonly found here in the knees. That's going to tell me it's usually not just in one place. It's going to be in another, which you've already kind of reported a little bit in your shoulders, so on and so forth. Okay. So with that said, it didn't require a huge major production or test. We could test more. This is just, let's check it out. It hurts. That's likely what's going on. We know the condition. Okay. With that said, we're going to try to palpate some of your muscles and see what we got going on there. Okay. Palpate means we're going to get in here and dig around. We already know it's going to hurt because your body, as I was touching the muscles from the get-go, they were sensitive, right? So these are going to be more like muscle fatigue type of symptoms that you're having. Okay?
Yeah.
So we'll have you lay face down there for me. Right there.
So I'm not going to see where... Okay.
Say it again.
I'm not going to see where...
Unless you have eyes behind your head, very likely not.
Wait, where do I put my arms?
There's some arm rests right there.
Okay.
Got it? Tender?
Yeah. Oh.
Ticklish or tender?
Tender.
Tender? Tender here?
Yeah.
Tender? Tender? Do you do a lot of standing all day long?
Yeah.
Do you feel like the back is more tender after a long day of standing?
I don't know.
It's just tender.
I don't really feel anybody touching my back usually.
Right. Well, it's not normal for you to have back tenderness when somebody's palpating the back like this. We find this. You can sit up. We'll chat a little bit because I want to kind of discuss what we were talking about that. I know it's a lot of sitting and standing on the first visit, but I want you to fully understand what are we doing here, right? So that way you're aware. Now you kind of know what's going on with the joints, right? Now we're talking a little bit about the back. We did muscle testing. All of your muscle testing seemed pretty good. So we checked the upper extremity and the lower extremity nerve system, and we feel like, okay, we got some good muscles. That's how you test the muscles, right? Checking how the nerves are doing. We know that. You're reporting lots of tenderness up and down your arms, a little bit like pain down your arms, right? Yeah. Usually that's going to be tied in with trigger points, okay? So trigger points send referred pain. So if you have a trigger point here around your scapula, it may refer pain down your arm, okay? Refer pain up and down the spine. That's how what I'm feeling that you have going on is some sort of what we call exacerbation of trigger points, okay? You know the word exacerbation? Kind of ish. So the trigger points are aggravated right now, okay? And so your body's fatigued, your body's tired, you need some sort of solution to kind of relax the body a little bit and decrease that hypersensitivity of pain that you're having. Okay, so how do we use that? We're going to use different machines here. We're going to use electronic stimulation to create a micro massage, okay? It's a little stim unit. You may or may not have seen it on our videos. If you watched our videos a little bit, it's going to create a micro massage in your body. I'll kind of walk you through that and show you how to use it, okay? Another thing we're going to use is a couple of hot packs, okay? So hot packs are going to warm your body up and try to bring some relief, increase in circulation, okay? After hot packs, we let that run for about 12 minutes. We're going to come in here. We use a lotion that's going to be for muscle healing, for soreness. We're going to use on your back as well. Then, as you've seen in the videos, chiropractic adjustment from top to bottom, okay? After the adjustment, we're going to set you up on a vibration plate that's going to help increase circulation, and that's how we address these issues. Now, how I tell all the people is like, let's not reinvent the wheel.
Yeah.
You've seen kind of all of our patients that get positive reports and this and that and 80 to 100 5-star reviews online. They've all received the same kind of treatment. And what we do is we get them better fast. We don't sign them onto some long treatment plan to try to sign right here and sign your life away. Hey, you know what? Let's get you better. Let's get you out of acute pain. And then let's go ahead and bring you back on an as-needed basis, once a month, once every 6 weeks, so on and so forth. Okay? So that's the approach we want to do. I want to get you better fast, efficiently, and without any type of commitments to long-term, long-winded treatment plans. Okay. Sound like a plan? All right, so we'll get started. I'm going to set you up with some E-stem. The way we do that is we have you lay face down. That way I could use some stimulation. I'll walk you through that, and then we'll put some hot packs on your back and let that go for about 12 minutes. Okay. Sound good? So lay face down there for me. Okay, so what we're gonna do with the machine here, okay? I'm gonna place it on some areas that are called trigger points that we just kind of gave you some information on what they are, right? So like right in here is a common area to have some tenderness when you have some trigger point issues. So I'm gonna put some right here and some around the shoulder blades here, okay? Now, what this machine is going to do, okay, it's going to create a micro massage into the muscle. So it's going to contract the muscle a bit, okay? What is the point of this thing? The point of this thing is to increase circulation, right? So that we could exhaust the trigger point, okay? We could get the trigger point that's aggravated and try to relieve some of this pain symptom. And this is what this machine helps with relieving pain as well, okay? So we're gonna use this machine. It's gonna run for about 12 minutes. So you're gonna control what level the machine is set at, okay? You're gonna control it like this. We want to get a nice deep contraction. We want to get some nice movement in there, but we don't want it to be painful because you're going to be using this for 12 minutes, okay? So you're going to tell me when we get to that level where it's like, oh, it's starting to get a little uncomfortable. We drop it back a few notches and we let it roll for 12 minutes, okay? In the meantime, you also have some hot packs on you, and so we let you relax in here. If you end up getting a snooze, great. We're going to start the machine. We'll start with the lower ones first. So you're going to start feeling something there, okay? Now remember, we want a nice deep contraction, but we don't want it to be painful, okay? So you tell me when we get to that level.
It's weird.
That weird there?
Yeah.
Can you go a little higher, or is that good? You want to try what a little higher feels like?
Sure.
Do you feel like a contraction?
Feels like my back's being like electrocuted.
Okay, then we'll leave it at that. We don't want to feel the electrocution. Let's try the upper one here really quick.
The upper one.
Or was that the upper one, the first one?
Is that what's on my neck or not my neck?
Like in here?
Yeah.
We have some pads on there. Do you feel those going?
Yeah.
Do you feel these down here?
Yeah, I feel those.
Okay. We're going to go with the upper ones right now, a little higher, okay?
What?
You tell me when to stop.
Okay.
Good? Does it feel as weird as these?
The ones on my back feel like electric eels.
Like little things are stimulating it.
Yeah, I feel like electric eels.
Eels.
Yeah.
You want me to lower it a little bit?
I guess it's fine. Did you turn them up?
Nope.
Okay.
They're gonna cycle though, so they're gonna go up and down. Put a couple of hot packs on you. Alright. So you've never had this type of treatment before?
No.
No? Have you ever had any physical therapy before?
Mm-hmm.
No? Massage? No massage before?
Mm-hmm.
Alright.
This is weird.
So you're a complete rookie.
Mm-hmm.
Alright. Okay. We're going to put a couple of hot packs on you here. Okay.
Am I sitting in this right? Like, am I supposed to?
Do you feel uncomfortable?
Like my face.
What about it? Feels uncomfortable?
Like I can't breathe.
Alright, so lift your head just a little bit.
Okay.
Try that. Better?
Does it like open up or something?
It doesn't, but I could remove. There, you can lay it side laying like that. And then when it gets uncomfortable, lay to the other side.
Cool.
I have the same issue when I lay face down on the table as well.